Hello, everyone. Welcome to our presentation on talking with your child about COVID-19. My name is Ashton Parker, and I am a registered psychologist with Edmonton Catholic Schools. Together with members of the psychology team, we've put together a brief presentation for parents. Our hope is that after watching the presentation, you'll feel better equipped to speak to your kids about COVID-19. As you're well aware, COVID-19 has led to many changes in the daily routines and lives of young children. Therefore, it's important that we talk to them to help kids understand the reason for the changes and what to expect. These conversations can be difficult to have, but are important. So we have put together some information to help. These are some of the common parent questions that we aim to answer during this presentation. So first, should I even talk to my child about COVID-19? Second, how can I start talking to my child about COVID-19? Third, how much information should I share about the virus? So there's lots of information out there, and knowing what to share and what not to share can be challenging. And last, how can I help my child if they're feeling worried? So what are some things that you can do and approaches that you can take to help them feel supported and secure? The first thing that I would like to address is that it's normal and expected for children to have different reactions depending on their age and developmental level. Preschool age children may exhibit regressive behaviors. They might appear to be talking less and appear more anxious. Elementary school age children might be finding it hard to focus. You might notice that they're more irritable or easily set off. They might be more clingy, so they might follow you around more and have difficulty separating or playing on their own. You might notice more aggressive type behaviors. They might be complaining more of physical symptoms such as stomach aches and headaches, and you might see an increase in the frequency of nightmares. For middle and high school age children, you might notice changes in eating and sleeping patterns, agitation, an increase in the number of conflicts with others, physical complaints. They might be engaging in riskier behaviors and pushing boundaries more often, as well as poor concentration skills. A child's response to the current stressor of COVID-19 can also be impacted by a number of risk factors, such as the level of parental support that they receive, whether or not they've been dislocated from their home or their community, what their exposure has been to the actual event, so this could include media exposure, whether or not they suffered a personal injury or loss of a loved one. So when we've had a personal experience, it's harder to cope and manage that stressor. The level of physical distraction, previous traumatic experiences, and mental illness. So for example, if your child has experienced a traumatic event or suffered from a mental illness, such as anxiety or depression prior to COVID-19, they may have a more difficult time adjusting to and coping with the current COVID-19 pandemic. There are some general principles to keep in mind when talking to children about COVID-19. So first, it's important to remain calm and reassuring. Remember that kids react both to what you say and how you say it. And they will pick up on cues from the conversations that you have with them, but also from the conversations that you have with others. Second, make yourself available to talk. Be sure that kids know that they can come to you when they have questions. You want to avoid language that might blame others and lead to stigma. It's important to remember that viruses can make anyone sick, regardless of a person's race or ethnicity, and you want to avoid making assumptions about who might have COVID-19. Give kids the space to share their fears. It's natural for kids to worry. but try to avoid saying things like, don't be silly or just don't worry about it. Instead, let them know that kids don't seem to get as sick as adults, and let them know that they can always come to you for answers or to talk about what scares them. And lastly, make sure your kids know that it's normal to feel stressed and worried at times. Everyone does. Helping them to recognize their own feelings and also helping them to know that stressful times pass and life gets back to normal can really help them to build some resilience. To introduce the conversation of COVID-19, first you want to find out what your child already knows about the virus and how they are feeling. This will give you a good starting place and help you correct any misinformation that they have. You can ask questions like, a lot of people are talking about a new virus called the coronavirus or COVID-19. Have you heard about it? What have you heard about it from people at school or from friends online? How are you feeling about what you know? For younger children, you might say something like, have you heard grown-ups talking about a new sickness that's going around? If you don't know the answer to something that they ask, be honest and tell your child that you can look it up together. You want to access websites like the CDC and Alberta Health Services for accurate information. Consider reducing the amount of screen time and media exposure that's focused on COVID-19, because too much information on one topic can lead to anxiety for anyone. After asking them what they already know, you want to share information with them at an age-appropriate level. To do that, provide information that is honest and accurate. Give them information that is truthful and appropriate for their age. Talk to them about how some of the stories about COVID-19 on the internet and social media might be based on rumors and inaccurate information. Keep information simple and remind them that health and school officials are working hard to keep everyone safe and healthy. Here are some examples of information that you might share with them. COVID-19 is the short name for Coronavirus Disease 2019. It is a new virus. Doctors and scientists are still learning about it. Recently, this virus has made a lot of people sick. Scientists and doctors think that most people will be okay, especially kids, but some people could get quite sick. Doctors and health experts are working hard to help people stay healthy. We are trying to do what we can to stop others from getting sick. Number 3 is to share with kids what they can do to stay healthy and keep their families healthy. This will give them a sense of control and responsibility. Engage them in a child-friendly way. For example, the whole family can become germ busters. You want to follow CDC and AHS recommendations, such as remind children to stay away from people who are coughing or sneezing or sick. Cough or sneeze into a tissue or your elbow. If you sneeze or cough into a tissue, throw it in the trash right away. Keep your hands out of your mouth, nose, and eyes. This will help keep germs out of your body. Wash your hands with soap and water for at least 20 seconds, especially after blowing your nose, coughing or sneezing, going to the bathroom, and before eating or preparing food. When washing your hands, follow these 5 steps. So you can wet, lather, or make bubbles, scrub your hands or rub them together, rinse, and, and dry. You can sing the happy birthday song twice or another similar song. If you don't have soap and water, teach kids to use hand sanitizer. Hand sanitizer should contain at least 60% alcohol, but of course you want to supervise young children when they use hand sanitizer so they don't swallow any. Keep things clean. So older children can help adults at home and school clean the things that we touch the most, like desks, doorknobs, light switches, and remote controls. You can find more information about cleaning and disinfecting on the CDC's website. And lastly, if you feel sick, stay home. Just like you don't want to get other people's germs in your body, other people don't want to get your germs either. And lastly, reassure children that many people are working hard to keep them safe. We also want to model calmness and, like we said before, answer questions they may have with age appropriate facts. Helping children to understand that everyone is working hard to keep them safe can be reassuring and help them to feel calm. Let them know that you are available anytime they have worries or questions and be there for them. Thank you very much for following along with the presentation. I hope that you found it helpful and informative and feel at least a little more confident in having conversations about COVID-19 with your kids. We have provided a list of resources where you can find more information about COVID-19 and sharing that information with your kids. I encourage you to explore these resources. The psychology team has also created a PDF handout for you that reviews the information discussed in this webinar and provides direct links to resources. Take care and thank you for your time. Please keep your eyes out for more presentations and resources from our team.